Hey everyone, good day to all. Myself, Dr. Ajay Maurya. Today I'm going to discuss about the next 50 MCQs from the Fmge guest paper. So guys, the PPT will be available in the Telegram and in the WhatsApp group. The link in the description. Okay, after the session, I will upload the PPT. So next, going to the first question is that. So the first question, what is the diagnosis here? See here, see here. Every time, see guys, every time they are going to give the one MCQ from the types of leukemia. So please make a table there. Types of leukemia: CML chronic myeloid leukemia, AML acute myeloid leukemia, ALL and CLL guys. So not no need to remember the all the important no need to remember the all the points, guys. Just remember the at least one point from one important point from the all types of the leukemias. For example, in the CML, they always give the history of the splenomegaly and there is a basophilia, and also that there is a chromosome called Philadelphia chromosome. That is number is T922. That chromosome is called as ABL-BCR. Okay, so just enough for the CML, and the drug of choice will the imatinib. Imatinib is also for the GIST, gastrointestinal stromal tumor. Okay, so next one is for the AML. See guys, for the AML, just remember the type 2 is the most common. Type 3 is called as acute, acute promyelocytic leukemia. It causes which is containing maximum rods, which is associated with the DIC also. And guys, DIC all are increases except the platelets decreases and the bleeding from the everywhere. So the what is the treatment for the AML3? It is the transretinoic acid. ALL occurs in the children's. Everyone knows is in children's. See, by the age group itself, you have to diagnose the cases here. ALL, it is the most common in the children. By just looking the age also, you can just mark the answer the ALL. Okay, now these are the ALL. We have two types: BALL and TALL. BALL for children, TALL for the teenagers. Symptoms like thymic mass and there is a CNS symptoms. For CLL, there is called the smudge cells. Smudge cells. The answer is CLL. See, there is a history of the autoimmune hemolytic anemia. They will just mention these points, and it is a occurs in the elderly. The answer will be the what is a chronic lymphoid leukemia. Okay. So next question is, guys, please master this table, guys. It's more than enough. Next one is the common micronutrient deficiency in the disaster. See, every time there is one question from disaster, guys. The most commonly disease reported in the post-disaster phase is the gastroenteritis case, and a common micronutrient deficiency is the vitamin A. Okay, na? And also the only vaccine given is that tetanus toxoid. You have to remember the cycle, disaster cycle. Okay, now see first disaster impact, response, disaster RRR, response, rehabilitation, reconstruction, then mitigation, then the preparedness. At the stage of the disaster cycle, you have to remember the cycle and the stage what they are going to do in the every phases. Next question. Possible resuscitation, life-saving surgery in next 24 hours comes under what trials? See, we have the trials here. See, which is the highest trial systems are useful in the emergency, guys. Two, in order to distribute the patient, you have to supply the patient according to their priority of the treatment. So red means immediate resuscitation. The patient who need immediate resuscitation or life-saving surgery within 6 hours. You have to put in the red one. Okay, in the yellow, the possible resuscitation or life-saving surgery in the next 24 hours, you have to keep in the yellow. Green means minor illness or ambulatory patient. Black means about to dead. Morbid means about to dead. The dead patient. The correct answer here will be the yellow. Guys, And guys, you can see here, the scalpel here, blades, needles, syringes with a fixed needle seats, needle and cutters are comes under what biomedical waste. You can see here, guys, yellow one, it is the human waste. See, human, animal, anatomical waste. They are anatomical waste, anatomical waste and a soil waste, expired medicines, and a chemical waste, body fluid, clinical waste are comes under the yellow. Yellow means what? Infectious. Red one is the plastic bags, bottles, pipes, containers, catheters. And the white means what? It is scalpels, blades, sharp edges. Okay, now see blue for B, blue. See B for B. See blue for B, broken for B. BB, blue, broken, BB. Okay, broken glasses you have to put in the blue. That's enough. Don't remember this. The last question is the here white one is the needles. Done. Yes. According to the Factory Act, maximum hours per week, including overtime, is it is 60 hours, guys. Actually, without overtime, you have to mark the answer at the 48 hours per week. But including the overtime, it is the maximum you have to do the 60 hours only. And also, please try to remember the here the what is the age limit and blah 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 blah. Please remember this, and you have to remember this also. Okay. And also, guys, please remember this one. Which of the following is not a live vaccine? See, hepatitis B. It is a what? It is a recombinant. It is a recombinant vaccine here. Recombinant HPV also. Okay, and there is a one pneumonia which is called as Rome is my best place to go at. This is by Priyanka Sachdev, madam. So these are the live vaccines examples, guys. Please try to remember this one, which is killed one, which is toxide, which is the polysaccharide, which is the recombinant. Okay, and guys, you can see here, uh, here, the strains are very important, guys. The strains are very important. For it's like for the moms, it's a gerillin, rabies fixed viral strain, rubella is a RA273 strain, varicella oca strain. Please remember these strains also. And also, guys, please remember the what vaccines are given at the what weeks. And also, guys, you have to remember the side effects of some vaccines like the BCG, DPT, measles. See, BCG for the osteomyelitis, it causes side effects of the osteomyelitis, this disseminated TB, and its diluent is a normal saline. DPT is the neurological shock. Measles, TS, toxic shock syndrome. Maximum chance of cold chain failure at the subcenter and at the village level. All live vaccines are contraindicated in pregnancy except the yellow fever. Next is, guys, most sensitive indicator for the iron deficiency anemia. It is the serum ferritin. Serum ferritin. As you know that, guys, if the MCV is less than 80, we call it as the microcytic anemia. Microcytic anemia. We can remember the mnemonic is called CETAL, sideroblastic anemia, iron deficiency anemia, thalassemia, A for anemia of chronic diseases, and L for lead poison. You can see here. You can also you have to remember that what happens in the iron deficiency anemia. There is a serum iron decreases. See, serum iron decreases and the serum ferritin decreases and the TIBC is increased. See, you can remember here is the serum iron is inversely proportional to the TIBC. If serum iron is low, then TIBC is high. Remember this one. Please remember this table. I don't know how you are going to remember, but remember this one. There are many tricks. Okay. And guys, and see here, if the MCV is more than 100, then it's called a megaloblastic anemia. Megaloblastic anemia. So you can see here that if megaloblastic anemia, we have two types, having the B12 deficiency and the folate deficiency. How you are going to differentiate between the folate and the B12 deficiency? See, in the B12 deficiency, guys, there is a CNS symptoms are present, but in the folate deficiency is not going to show any CNS symptom. But it can have the risk of the neural tube defect in the pregnancy. In the B12 deficiency, guys, you can see the methyl malonyl CoA acid, which is going to increase in the urine. But here in the folate deficiency is going to the normal here. You can see here the cabot ring here, or Hawley jolly bodies. You can see in the B12 deficiency. B12 deficiency is the most common in the vegetarian people. They're going to mention the word the patient is a vegetarian, then is a B12 deficiency. You have to treat like this. And also, guys, please remember the iron absorption. What are the steps which are going to increase the iron absorption? Which are the following are going to decrease the iron absorption? Increase the iron absorption is that acidic pH and vitamin C is going to increase the iron absorption and decreases the tannins in tea, phytates, and the alkaline pH. Phytates means the like sprouts. What is the site is the duodenum. Site is the DOC ID. I means iron, D means duodenum. ID card I iron, D duodenum. Stored form is called as ferritin. Transport form is called as transferrin. The transport record is called as DMT1 divalent. Okay, hepcidin inhibit the ferroprotein. Just remember this point, get to master anything, and we have the Menger index. Next is the nitro blue tetrazoleum test is done for the chronic granulomatous disorder, CGD. B is the correct option, green one. So guys, there is a one table. I took this from the Dr. Preetimam lecture. So here, guys, they are always going to ask the one MCQ from this table only, guys. This is going to be from the chronic granulomatous disease, guys. There is an enzyme called as NADPH oxidase. There is going to be the deficiency. NADPH oxidase. Actually, guys, for the screening test, guys, you have to going to do the NBT. For the screening, you have to do the NBT test. For the screening, we can also do the dihydroamine DHR test. You can also do the for the screening you have to do the NBT, and we can also do the DH. We have to do the DHR test. Okay, and the enzyme responsible for the respiratory burst is the NADPH oxidase. NADPH oxidase. This enzyme is multi-component complex that transfer the electron from the NADPH to oxygen and generating the superoxide. Okay, now, so last time question, guys, they asked that in the respiratory burst, which enzyme is which enzyme is? It is the NADPH oxidase. Please remember this one, and remember this one. This one the cardiac Higgs syndrome, the list gene, all seen in the CNS abnormalities, albinism. Please remember this one, guys. Okay. The next one is the guys. This shows here is a slide. It is the guys. The appearance is called as starry sky appearance. It is the starry sky appearance. Starry sky appearance, which is seen in the Burkitt lymphoma. Burkitt's lymphoma. Okay, so Burkitt lymphoma, it is associated with the Epstein-Barr virus. Epstein-Barr virus is seen in the Africans. We'll get the picture like this. Just you have to identify. Okay, and just remember this. And you have to remember the chromosome, the 814. See, Burkitt's B. If you see Burkitt's B, you have the 2 zeros. Its B look like 8. So 8 plus 8, 14. 8, 14. Done. And guys, also remember the multiple myeloma, guys. See, always they are going to give these two in this one, Burkitt's and the multiple lymphoma. See, multiple lymphoma, guys, remember this one, mod cells with the Russell bodies. We have the Russell bodies. See, Russell bodies, multiple myeloma. There is going to be the one history is that a elderly patient with lower back pain, with lower hip pain, they get hip pain, and they will give something, and the answer will be the multiple myeloma. There is a multiple myeloma is guys. It is the tumor of the plasma cells. Tumor of the plasma cell. There is going to the more number of immunoglobulins, and there you will see the M spike. There is the most common immunoglobulin is the IgG. IgG. And the chromosome is, guys, is the 1114. 1114. How do we say multiple 11 see LL 11 14. Okay, let's remember this one, guys. Okay, so the next question is, guys, so the next question is, guys, a 61-year-old female patient suffered from the stroke. See, they told us suffered from the stroke. Stroke means it is related to the brain. Despite all measures, the patient succumbed to the illness on the 5th day of the observation, which is the for necrosis. They ask the necrosis of this brain. So, guys, for the necrosis, guys, please remember, guys, we are having the total comment at 2, which are 6 type. Okay, the first one is the coagulative or parent necrosis. Guys, coagulative or parent necrosis. They will also give the images you have to identify, guys. The first one is the coagulative or parent necrosis. Example is the heart, kidney, liver. Heart, kidney, liver. Heart, kidney, liver. Heart, kidney, liver. Next one is the caseous necrosis. Caseous necrosis. Example is the it's a cheese-like. Example is the TB, histoplasmosis, sarcoidosis. Third one is the liquefactive or colligative necrosis. Liquefactive or colligative necrosis. Example is BAP, 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 brain, abscess, pancreas, meaning the parenchyma of the pancreas. Next one is the fibrinoid necrosis. Fibrinoid necrosis in the SLE, rheumatic fever, TAN, and the malignant hypertension. Fat necrosis in the BOP, BOP, fat, breast, omentum, peripancreatic tissue. See the gangrenous necrosis. We have the two types, wet and dry. Wet and dry. Wet we have in the, it is the, in wet there is a increase, there is chance of the coagulative necrosis, and dry there is a chance of the liquefactive necrosis. Examples are the diabetes mellitus, Burger disease, mucormycosis, and the frostbite. Next one is, guys, the CA19-9 is a tumor marker of DAS. It is a tumor marker of the pancreatic cancer, guys. Please master this table, guys. The tumor, the beta HCG, choriocarcinoma, calcitonin, medullary cancer of the thyroid, catecholamines, pheocytochroma. Please master this table, guys. And guys, all are true for the gist. Gist means, guys, it is the gastrointestinal stromal tumor. See here. See, most common mesenchymal tumor of GIT is strong. Yes, originated from the cells of Cajal. Yes, it is a pacemaker and genes responsible for the KIT and the CD117 marker. Majority is in not duodenum. Okay, now see here. What are the genes are responsible for the gist are KIT, PDF, GRA, SGS, and the BRAF. It is a hematogenous spread. Most common presentation are upper GI hemorrhage, mass, pain, and perforation. Investigation of choice, it is the CECT, it is the mesenchymal, not the duodenum. Okay, now then is the next one is the what are the diagnosis? You can clearly see, guys, here you can see that these cells are, this slide is like the orphan Annie eye appearance. Orphan Annie eye appearance. There is a cartoon, they see the eyes, they are looking like this one. This is called this is in the papillary thyroid carcinoma. Papillary thyroid carcinoma. So this is the most common. See, papillary, popular, popular means most common type of thyroid cancer is the papillary thyroid cancer. Papillary thyroid cancer, we have the BRAF and V600E mutation. There is a history of the radiation exposure, orphan Annie of the eye. There is a samoma bodies which is called as the dystrophic calcification. For the follicular thyroid cancer, guys, follicular cancer, it is not diagnosed in the FNAC examination. You can see is the follicular RAS mutation, and there is a capsular invasion, and all are lymphatic spread, but follicular it is the hematogenous spread. Coming to the medullary, see, medullary is muddy fellow. All are originating from the all are originating from the what? See, see guys here, medullary is very unique because see medullary third carcinoma is the only one which is arising from the parafollicular cells. All are from the follicular cells, but these are arising from the parafollicular cells or the C cell. Parafollicular cells are C cells, which is what the C cells do. It is increases it helps in the increase in the calcium by it is a calcitonin. It releases the calcitonin. So if there is a tumor, then what happens? There is a more production of the calcitonin. Okay, now, then there is a more calcium in our body. There is a what are the genes? Red 10 meant to be, and there is a amyloid called acyl amyloid. Please remember, they will ask the question as which are the following thyroid cancer associated with the men. It is a medullary. Then the most radiosensitive tumor among the following is, so guys, please remember this table. Always there is a one question. Always there is one question from this table only, guys. Please remember, last time they asked that just the following is the most radiosensitive. Yes, last time you have to remember the last time they gave the something seminoma only. Okay, like gonads. Okay, now gonads is the most sensitive. So remember the neurons are the least sensitive. Neurons are the least sensitive. Tumors are the like Ewing sarcoma is the most radiosensitive and the least sensitive is the osteosarcoma. Please master this table, guys. Please. One MCQ is per sure. Next coming, guys, this is going to discussion here. So a 70-year-old woman complains of thrombic unilateral headache and vision problem. She reports weight loss and mandibular pain while eating. The patient also had history of recurrent bouts of fever accompanied by malaise and muscle at 300 standard joules HS. Physical examination reveals nodular enlargement of the temporal artery with pain or palpation. A biopsy is obtained, shows giant cells. What is the appropriate diagnosis? This is, guys, it is going to the clear-cut case of the giant cell arteritis, also called as temporal arteritis, guys. So these are the features of the giant cell arteritis. You have to see the most common presentation is the headache. Specific is the jaw claudication and dangerous is the loss of vision. We'll see the image here also, guys. Guys, you have to discuss about the types of the vasculitis here. Types of vasculitis, which is the large. See, temporal artery is also a large vessel vasculitis. Next one, we have the Takayasu arteritis. You have to remember that it is a pulseless disease. Pulseless disease, most common vessel involved is the subclavian artery. Berger disease. See the Berger disease. See, you have to remember we have got a Berger and a Berger. Berger is called as the IgA vasculitis, but BU, see, your study U as V for vessels. See, this Berger disease is also called as TAO. This is called as the thromboangiitis obliterans. This is associated with the smoking. Okay, now you have to treatment is the stop the smoking. PAN, polyarteritis nodosa medium. Please remember this one. You have the history of the hypertension, fibroid necrosis, and multiple organ failure. Most common vessel is the renal vessels. Viral markers were in the HBS, surface antigen, antigens. Yeah, the nerve involves the pulmonary vessels. See, you have to remember that, guys. Kawasaki and the HSP. Kawasaki and the Henox-Lennon purpura. Kawasaki it occurs in the less than 5 years old, which is fever is not more than 5 days, guys. You have to remember there is a cream criteria. Cream C conjunctivitis, bilateral conjunctivitis, which is non-accident, and there is a rashes, polymorphous rash, and edema, adenopathy, cervical adenopathy, mucosal enrollment, guys. You can see the strawberry tongue and the fissure lips. Drug of choice will be always they're going to be the IVG, immunoglobulin, and high dose aspirin up to 80 to 90 mkd every 6 hours. Next one is, guys, Henox-Lennon purpura, HSPT, the small vasculitis, which is also called as IgA vasculitis, which is most common in the most common in the Berger disease, Berger disease called IgA nephropathy. Okay, now IgA nephropathy. Please correct this one. And see, HSP is called as IgA vasculitis. Okay, the most common seen in the children's. You have in the we have a history of the purpuric rash, lower limb, that and at the buttock, at the abdominal pain, GIT is colky pain, arthralgia, renal involvement is the nephritis. Treatment will be the self-limiting. Only the steroid when the steroid is required is the when there is a severe GIT involvement. When there is severe GIT involvement, guys, then you have to give the oral prednisolone. Yeah, the vagus granulomatous is small, which involves the lung, kidney, and the you have the strawberry gums. C. Vagus, you have the antibody. C. Anka. Cyclophosphamide is the drug of choice. Please remember that lesson. Next one, guys. All examples of non-anionic gas metabolic ester except. See, guys, here we're having the Nagma, Hagma. Nagma, Hagma. Nagma means normal anion gap metabolic acidosis. Hagma, high anion gap metabolic acidosis. Okay, now see, remember only one. Nagma. Remember Nagma, that is having the, remember mnemonic is the RAD. RAD, RAAD, RAD. We have the renal tubular acidosis, Addison's disease, estrogelamide, aldosterone, diarrhea, like the GIT related. So you can see here the aspirin here, the aspirin is coming in the Hagma. So please remember this table, guys. And also here is the what are the most common causative agent for the disease. This is thumbs up sign. You have to see that is the case of the acute epiglottitis. The most common is the strep pneumonia. Strep pneumonia. If the patient is not immunized with the HIV, then it's going to be the H influenza. H influenza, or else it is the strep pneumonia. You have to differentiate between the epiglottitis and the Krupp syndrome. Epiglottitis is the thumbs up, and this is the stipple sign. Please study the characteristics, guys, and that management also. The next one is the gray color test is for. Gray color test tube is for. See, gray color test tube is for what? You have to see here it is the for the anticoagulant. See guys, for if you want to do the glucose, if you want to do the blood test for the like sugar test, you have to what you are going to do, you have to extract the blood and you have to keep in the gray test tube. What is there in the gray test tube? We have the anticoagulant, we have potassium oxalate, and we have the addictive is the sodium fluoride, which is inhibit the what? Glycolysis. Okay, now so that's why there is a you will find the glucose. You will find the glucose levels in the blood. You will know the how much is the glucose levels. Please also remember the others also, guys. Please, okay. Please study. The next one is, guys, the all are comes under men to a except, guys. See, men to a see. Parathyroid, medullary thyroid cancer, pheochromocytoma, house pregnant disease are to a and Marfan medullary pheochromocytoma and mucosal neuromyelitis that coming in the men to be. Please remember this one. And also, guys, Cohen's syndrome does not include Cohen's syndrome. We have total Cohen's and the Addison's, guys. See, if you remember the Cohen's syndrome, you will automatically remember the Addison. See, Cohen's syndrome. See, Addison syndrome is the opposite of the Cohen's syndrome. What happened in the Cohen's syndrome? We have in the primary. It is due to the hyperaldosteronism, hypernatremia, hypertension with no edema. No edema. That's magic. Okay, now. If you have the hypertension, it means there is edema, but there is no edema. Hypokalemia, we having the metabolic alkalosis and the lower renin. These are all opposite. It is the Addison disease. Please remember this and please do not do any mistake in the exam. Next one is, guys, vitamin that helps in collagen synthesis. Obviously, it is going to be the vitamin C. Please remember the biochemical assay of the vitamin deficiency. See, for the vitamin B1, and we are going to do the RBC transketoase test. For the B2 riboflavin, we are going to do the RBC glutathione reductase. For the B6 paradox, we are going to the RBC transaminase Figlu acceleration test you're going to do for the folic acid B9. For serum methyl malonate level, you have to do the for the cobalamin for the between B12. That's simple. And also, guys, vitamin C also helps in the what is scurvy. Okay, deficiency leads to scurvy. Now, please master this one. X1B. See, night blindness. XN, night blindness. X1B, conjunctival xerosis. Please remember this one, guys. Please study about all the types of the vitamins you are. They are going to very, very important, guys. And I wrote here all about the vitamins. Please study. Please study, guys. The next one is the 42-year-old lady working as a school teacher presents on endocrinology OPD with flushing of face, signs of pulmonary edema, diarrhea, dermatitis. Further workup revealed that an appendicular mass and following compound came detected in the urine. See, guys, this is going to the case of the carcinate tuber. Obviously, everyone knows the answer is the 5-indole acetic acid. See, but the most common site is the GIT and the bronchus. Marker is the chromogranin. Okay, due to the overproduction of the 5-HTC serotonin. Okay, na screen test is the what is 24 hours HIA the indole acetic acids. Okay, HIAA level. We have to please remember the study the carcinate tumor in a very clear way, guys. Okay, na systemic fibrosis, hepatomegaly, intestinal diarrhea, vasomotor, flushing of the skin, and the asthma-like features. Next one, guys. A tumor in the anterior pituitary pressing on the optic chiasma. Optic chiasma will present as a case of, it is, guys, the case of the clear-cut case of the bitemporal heminopia. Please, guys, remember these image. This will be, they are going to ask at the case basis. They will give a big cases, but at last they will give this image. You have to remember this, guys. Okay, now this is the both sides. This is the bitemporal heminopia, same side here, and this is the contralateral. Please study this one, guys. This is on the macular sparing, contralateral macular sparing. They will just give this diagram, guys. You have to identify which is the what is the condition you have to. Please remember, guys. At least remember this bitemporal heminopia, guys. The next one is there. A male patient chronic smoker presented with cough with skin hyperpigmented during the further evaluation, high cortisol levels and remain high. See, guys, here there is a good mnemonic by Dr. Ashish sir. I want to thank you to Dr. Ashish sir, because when I was also preparing for the Fmge examination, I was very confused about this topic. I took it from the Dr. Ashish sir notes. So here, see here, guys, for the dexamethasone suppression test. See, dexamethasone, low, first of all, is the low dexamethasone. If you go to the low dexamethasone, it's actually what's going to happen is the by morning, guys, you have to get night, by morning, guys, it will going to be low. It must be low. Then it is normal. See, low, normal, low, normal, normal. See, if it is high, see, if you give the low one, if it is high cortisol, then it's a low he. Okay? Low he means Cushing syndrome. It means it is a case of the Cushing syndrome. In case of high dexamethasone suppression test, if it is low, it means it is having the Cushing disease. Cushing disease is associated with the pituitary adenoma. Low Cushing diseases. If it was still remains high, if it was still remains high, then in case of the low. If it is a high, then it becomes a low. It's called the, if it was high and it will low. See, low, it is the adrenal. It is the case of the adrenal Cushing, and if it was the still high. See, if you give the high cortisol level, high cortisol, it will be low, high. It will call the low, high dexamethasone, high cortisol, and if there is a low, see guys, please remember this one, high dexamethasone. It has a high, if it is remains high cortisol, okay, na? And there is a low ST. There is low ST. It is low. It is the adrenal Cushing. If there is still high ST, there is still high ST. See, it is called as a ectopic ST. He. See, high cortisol, high ACTH, and it is case of the ectopic ACTH. Please remember this one. I don't know how you're going to remember, but try to remember this. And also, guys, please remember this one, guys. Please remember this one. The other image based, guys. Image based question. We have to get. We'll get the to look at the cranial oculomotor trochlear. Please remember this one, guys. Please remember this one. And this is the third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th, 12th cranial nerves, guys. Okay, now please remember this one. And also, guys, please remember the circular villus. Circular villus, guys, this is going to the anterior, posterior, medicerebral artery. See here, guys. See here, posterior communicating artery. This is going to the what? See here. Everything. See, guys, everything here is going to internal jugular vein. See here. See, it is the posterior communicating artery. It is the internal carotid artery. It is the anterior communicating artery. See here, guys, anterior cerebral artery, communicating artery. See, guys, all are going to see here. All are going to make the circular villus, but medial cerebral artery is not involved in the circular villus. Please remember. Okay, now the MCA is not going to form the circular villus. Please try to remember this one, guys. And also, guys, there is always one question to mark this one. Please remember this is the corpus callosum, left is the lateral ventricle, third ventricle is going fourth ventricle, and this is the cardiac nucleus, and this is the lentiform nucleus. Okay, now this is the lentiform nucleus, thalamus. So, guys, please remember this is the capsule. This is the internal capsule. Last time they asked the internal capsule. This is the this is the corpus callosum fibers. Please remember this. Please remember this one. And in this one, guys, please try to remember this one, guys. See, please remember this one, guys. See, gluteus medius. See, gluteus medius. See, yes, muscles, gluteus medius and minimum muscles is supplied by superior gluteal nerve. Superior gluteal nerve. L4, L5, S1. See, it acts as the abduction at the hip joint and stabilize the pelvis while walking. Okay, now what are the gluteus maximus supplied by the nerve? Inferior gluteal nerve. Okay, now see, IG, inferior gluteal maximus, IgM, see, Ig max. IE means inferior gluteal nerve supplied by to gluteal maximus muscle. See here, what happens here? See, this is the gluteus medius and minimus. Gluteus medius and minimus muscle, which is supplied by the superior gluteal nerve. What happens there is if there is injury to the superior gluteal nerve, will gluteus medius and minimus works? No, it's not going to work. What is the function of the gluteus medius and minimum, guys? For the abduction. If the nerve is injured, then what happens there? Muscle will not work. There is no abduction. That's why patient will move like this, move side, lurching movement, and by the help of this one here, this one, he'll walk like this. That's why he will swing the leg. See, he will like this. He will swing the leg up to walk, to give the support, and he will by his lurching the shifted center of gravity. By this only, guys, he will get the support and he will walk. Okay, now. The same side will be there is a okay now the same side there is a same side. Okay, they will give that there is injury at the left. It means there is what in the same leg only there is a problem in the abduction, guys. Please remember this one. That's why which of the following ligament is pierced during lumbar puncture right before the entering the dura mater is going to the ligamentum flavum. Please remember, guys, this one very important, guys. What are the layers pierced? First one is skin, next subcutaneous fascia, there is a supraspinatus ligament, interspinous ligament, ligamentum flavum. Please remember this one, guys. Please remember this order. I think you know about this one, guys. Please, okay now. So they will ask the toughest level, the toughest layer is the ligamentum flavum, guys. Ligamentum flavum. Okay, now they'll just ask which is the last which is the last layer to pierce in the during the epidural anesthesia. The So please remember this one. And also, guys, in the anesthesia, also, guys, there is going to the American Anesthesia Society Association Anesthesia. So anesthesia American Anesthesia Association, I think so. ASA, okay now. See, these are the grades. So grade 1 is for the healthy people without comorbidities. See, grade 1 is the healthy without comorbidities. Grade 6 is the brain dead. First one is the healthy. Last one is the dead. First healthy, last dead. Second is milder. Third is moderate. Fourth is severe disease, and fifth is the morbid patient, means about to death. So guys, please remember this one classification. Yes, a classification. This is a Mallampati score. I think everyone knows Mallampati score is for the what intubation. But you have to see the and these are the guys here. These are the what is this one? Carbon dioxide. This is one there. But is always oxygen, black body, white shoulder, black body, white shoulder. Nitrous oxide, blue body. Carbon dioxide, gray. Helium, brown. Please remember the guys. This is a pin index. There is a pin index. Please remember AON. See AON. A for air, O for oxygen, N for nitrous oxide. See, A means air 1.5, oxygen 2.5, nitrous oxide 3.5. AON, A 1.5, O 2.5, nitrous oxide 3.5. Done. Next, we have the color coding of the Pyqs also, guys. Okay, now air for the black, oxygen white, and nitrous oxide blue, vacuum is the yellow. Please remember this one. The next one is, guys, a 38-year-old man undergoing a nerve block for a lower limb surgery at the community hospital in the Chennai accidentally received an overdose of bupivacaine. He rapidly develops confusion and tremors followed by the cardiovascular instability. The first line always is going to be the 20% intralipid, 20% intralipid. In this, what happened, guys? They are going to inject in the artery, guys. They are going to accidentally they are going to inject the bupivacaine in the artery, guys. That's why this happened. That's why all the symptoms are showing. That's why you have to give the 20% internal. Also, there is, guys, a 35-year-old woman is scheduled for the minor surgery procedure at a daycare surgery center in Bangalore. The anesthesia team is deciding on IV induction that facilitates rapid recovery post procedure. All the following for the same day discharge. Same day discharge, the daycare surgery. You have to do the for the quick recovery. You have to give the propofol. Please remember the guys propofol about the propofol, guys. Propofol is contraindicated in the allergy in the egg allergy patient. In the egg allergy patient, it is look like a propofol is like a milk like it's a milk like appearance. So okay now, please tell you about this one. Now also, guys, what is the compression ventilation ratio in adults? What is the compression ventilation ratio in adults? If no advanced, see for the adults, guys, you have to always do the 30:2. 30:2. For the pediatric, it is the 15:2, and the neonate is the 3:1. For the 3:1. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Like this one. So please try to study this one. Questions like here. Second gas affect diffusion epoxy is a nitric oxide. Please master this table. Also, guys, please remember this one. Mapleson Jackson rate cycle is used in the pediatric. Mapleson F. Okay, now it is a in pediatric. Mapleson D is used for the adult control for the used in the adults. Okay, now atracorium and cis atracorium for the Hoffman elimination. Safe in children. Sevoflurane breast milk. We have to avoid 4 hours before the surgery. Full meal 8 hours before the surgery. Post-dural puncture headache after 48 hours is the we have in the see after the see here there is a after the puncture after the lumbar puncture guys after the lumbar puncture guys they are going to develop the headache after the 48 hours. So you have to give the caffeine and you have to always put the patient in the sleeping position. 82-year-old female chief complaint of vaginal discharge with lower abdominal pain tenderness. Which color is? So guys, you have to remember the kit also. It's going to the yellow kit. Yellow kit 6. It is because of the PID. So guys, remember here this is the see gray color. See gray color. It is for the urethral discharge. Urethral discharge. Gray 1. Okay, now see it is also for the guys vaginal. See if the question says that there is a vaginal erosion. Okay, now then also what you're going to mark. Please mark the answer as the kit 1 only because vaginal erosions are also comes in the kit 1 only. Kit 1 only, guys. Okay, now vaginal discharge only it is seen in the 2. Okay, now all are seen in the 1 only. Please remember this one. You have to remember that this 3, 4, 5, 6 as the WBC. W means white, B means blue, red means C means congestion means red only. Okay, got it? 50-year-old present to the dermatology OPD. I think you all know about this one. This is the silver case. This is the case of the psoriasis. Drug choice is the methotrexate. We have 2 tests. Gutter psoriasis. There is a raindrop like rash and the sore throat is going to be the gutter psoriasis. Is the drug choice is the antibiotics. Pustula psoriasis there is a more pustula. Drug choice is the methotrexate. Triad of arthritis of weight-bearing joints, arthritis conjunctivitis is going to the Reiter syndrome. Is going to Reiter syndrome. Please remember, guys, Reiter and Reiter syndrome is this one. Reiter syndrome is called as the yes. This is the staphylococcal scarlet syndrome. Okay, now see here, guys. Reiter see here. Reiter syndrome here can be, can see, can be, can't see, can't be, can't hear. SNH sensorineural hearing loss is in the case of the Alport syndrome. A young lady present with following lesion. This is lacy. Here is a lacy lenticular variant. Here you have a lacy like a, you can see that there is a CVT bodies. We will see the CVT body while the histopathology is it is the case of the lichen planus. Please, guys, please master these. Please master the images, guys. Okay, now the one MCQ is going to show short from this one, guys. Please take a screenshot and please study hard, guys. Please study hard. Please look at these images carefully. I made this slide. It took me for the 1 hour to prepare this one. Please study this one. I think you know this is niacin deficiency, Madura food comedans, Echin vulgaris, this is Echine, this is a sterilization BT leprosy, this is marginal also the marginals also due to the what you call the bone, HP Henderson Peterson body in the molluscan is Erypsella, herpes zoster. You see here this is scabies, 5% permitted melanoma, this is erythroasma red one. Please remember this one, okay? And also, guys, please remember these. Also, guys, these are the some sexually swellings. So these are sebaceous cyst, dermatitis, this is ranula, and please here this is particular swelling. So okay, and also, guys, there are types of wound also class 1, class 2, class 3, and clean surgery class 1. So for the class 1, guys, class 1 wound there is a clean, no evidence of infection. Clean surgery, no antibiotic required. Class 2 is the clean contaminated. That is the elective surgery. The genital urinary surgery, minimal infection, you have to do the antibiotics. Please remember this one, guys. One remember. And also, please remember there is a ulcer types of ulcer: arterial, venous, and trophic ulcer, and marginal ulcer. Guys. Okay, venous ulcer seen in the venous ulcer there is a sloping ulcer. This is sloping ulcer is in a venous ulcer, arterial. See guys, venous. See, veins are located superficially. Now, veins are located superficially. That's why there is no deep here. There no deepening here. See, this is the only outside only. Venous ulcer, arterial ulcer. See guys, the trophic ulcer, in the leprosy, and the marginal ulcer due to burns. Please remember this one, guys. Please remember this one. A 30 years old prima gravida at 39 weeks has been completely dilated and been pushing up for 3 hours. She is exhausted. The fetal heart rate is 100 per minute. The patient's cervix is completely dilated and they are effaced. The fetal bones are at the -3 station. What is the most appropriate step in the management? So guys, see guys, she's pushing for the 3 hours, almost 3 hours, and the there is a complete, and also guys there is a complete, the service is completely dilated, but still the fetal bones are the see the at the see guys there is a station is -3. Oh my goodness, it has to come to 1, but it is pushing for 3 hours. You have to immediately do the CS, guys. Immediately do the CS. These are the types of questions you are going to get in the exam, guys. What is the way of the delivery? CS or normal? CS or normal? What you have to do? Please try to remember this, guys. Okay, now next question is: a woman at 32 weeks pregnancy with a BP of 117/110 and urine protein is 2 plus and dipstick C had the chief complaint of history, headache, and the blur vision. So guys, this is going to case of the impending eclampsia. Guys, you have in the epigastric pain, headache, seizure, and visual disturbance. You have to give the MGS for labetalol on the intraoperative level. Okay. So guys, for the management of eclampsia, guys, please remember the Pyqs regimen. Loading dose is 4 followed by 10 grams in the each buttocks. See here, you can maintenance in the 5. Before giving maintenance dose, you have to check the always show that there is either a deep tender difference. It must be positive, and the urine output must be 100 ml in the 4 hours, and the respiratory rate will be the more than 12 beats per minute. But the toxicity antidote is the calcium gluconate. Please remember this: when there is a when there will be the knee jerk loss, when there is a toxicity, MGS4 is more than the 10. So if they give the MGS4 is a more than 10 MEQ. Okay, na 10 MEQ. Please remember this guy how to, and also remember the management of hypertension in pregnancy. Please remember this one. Laboratory first try, chronic is my methyl dopa. Please remember this one, guys. Please remember. Also, guys, there is a 32 years old patient with 36 weeks pregnancy comes to OPD as profuse, painless. See, you have to always remember this: placenta previa and abruptio placenta. Placenta previa, it is a bright red color, painless bleeding, and there is a non-tender uterus is soft. Abruptio placenta, abruptio means dark red, is painful. The tenderness there is. You have to always remember like this one, guys. Next one is the following is indication for the surgical management of ectopic pregnancy. Ectopic pregnancy, guys, you have to see always the size here. See the size is always the more than 4 centimeter. No, always is the less than. Sac is, see, sorry, it is not size, it is sac. Sac is less than 4 centimeter. Beta acidity, it must be less than 5,000. Must a patient wants to continue a pregnancy, and no, there is a unruptured. If there is an unruptured ectopic pregnancy, then you have to do the surgical management. Please remember this one, guys. Most common site is the ampulla, fallopian tube. The triad is called abdominal pain, amenorrhea, and the vaginal bleeding is the drug of choice is the methotrexate 550 milligrams. This one is the Diabetic patient, lady with 32 weeks of pregnancy, and on the UCG fetal weight is 4 kg. 4 kg is going to case of the macrosomia, guys. Macrosomia, and how to do the elective LSCS, guys, at the 38 weeks. Please study this one, guys. This is going to be very important one. Very important one, guys. So most specific, this is going to diabetes in the pregnancy, guys. Diabetes in the pregnancy, you have to please master this one. You have to add if you've seen in the 24 to 28 weeks, you have to give that 75 grams of the oral glucose but not GTC. It is going to the glucose oral tolerant test. Okay, na? 75 grams oral glucose tolerant test. Always you have to give the insulin as the first choice. If the insulin are not responding, then only you have to give the oral metformin drugs. Most common malformation is the CVS. Most common congenital anomaly is the VHD. Okay, na? Please remember this one, guys. Management also. Next one, 6 weeks pregnant with the MVR on warfarin. Oh my goodness, warfarin. This is you have to do the see how to do the always you have to first stop the warfarin and start the lower molecular heparin, low molecular weight heparin. Okay, now so guys, please remember this one. If the patient is not pregnant, you have to give the warfarin. In the pregnancy, guys, up to 12 weeks, you have to give the heparin. That is also they will mention as the enoxaparin. For the 13 to 36 weeks, you have to give the warfarin. 36 weeks, you have to again give the heparin. And then so postpartum, you have to give the warfarin. Please remember this one, anticoagulants. And there is, guys, all of the following are predisposed to polyhydramnios except see, guys, remember this one, polyhydramnios. There is anencephaly, esophageal. See, poly means many, means omelets. There is more liquor. See, anencephaly, I know that there is open head. That's why there is chance of the more water. Esophageal, duodenal atresia, macrosomia, maternal diabetes mellitus, and the diaphragmatic hernia. Diaphragmatic hernia. Renal agencies, IUGR, preeclampsia, uterine insufficiency, anxiety, postpartum pregnancies. They are the case of the oligohydramnios. Okay, now please remember this one. Next question is here you have to, guys, remember the difference between the PCOS and the OHHS, ovarian hyperstimulation. PCOS, guys, we have to we'll see the small follicles at the periphery, but we'll see the multiple big follicles here. See here, there will be the triad called this is the amenorrhea or this is infertility. The hirsutism is the facial growth, hair growth, and the enlarged ovaries, and this gives the appearance called a necklace string of parallel appearance. The choice is the first is the letter. Please study this also. And also, guys, OHS, ovarian hyperstimulation syndrome, there is always the multiple big follicles with S sites in more water, and there is a history of the IVF treatment. Also, guys, twin pregnancy, dichorionic, diamniotic, there is going to the lambda sign here. This is lambda sign, and there is a T sign in the monochorionic diamniotic. The most common is the DCD, dichorionic, diamniotic. The division occurs at the more than after within less than 72 hours, then going chance of the DCDA. If it occurs if it occurs within the 4 to 8 days, it is chance of the MCDA. More than 8 days, MCMA. More than 12 days, conjoined twin. Most common variety is the thoracophagous. Please remember this one, guys. Okay, the best time to see there is a twin pregnancy is the 11 to 13 weeks. Please remember this also. Also, guys, all are true about the changes during the pregnancy. See here, clotting factors 11 and 12 increase. No, all clotting factors are increases except 11 and 13. The 13 will decrease. Please remember this one, guys. Please remember this one. And there is one mnemonic called ICTV and movies. IC inspirating capacity, tidal volume, minute voltage are increases, and IRV is constant. It is the inspiratory reservoir volume, respiratory rate, and the vital capacity. Please remember this one also, guys. Please remember this also. And I have some few extra miles in the OB-GYN. Please remember the guys, Sheehan syndrome, Asselman syndrome, and most common secondary pregnancy, And primary is the ovarian deficiency, Kallman syndrome. I think you know about that one. Decrease in GNRs and having the anosmia, Turner syndrome, streak ovaries, and webbing of neck. Cryptomeria is a hidden menstruation. This is a cyclical abdominal pain. So and also oligospermia, sperm count less than 16. This is the new one. And the total mortality must be 42%, and the morphology must be 4%. Endometriosis, I think everyone knows this, that there is a dysmenorrhea, there is a chocolate cyst, under TVS. The adenomyosis, guys, you had a gallbladder and a tender to touch. I think you know, menorrhagia plus the dysmenorrhea, and you have to treatment is the total abdominal hysterectomy you have to do, and the fibroid, guys, you have to remember that there is the intramural is the most common. We are having the submucosal and the subserosal. Please remember, they will give the images and you have to identify. And also, guys, we are having the types of the pelvic. They are gynecoid, android, arthropoid, and the platypoid. Most common is the gynecoid, guys, and android is the prominent inlet in the males, and the females is the gynecoid, guys, and there is a phase to PVC delivery is seen in the anthropoid, guys, and least common in the platypod. Then, guys, a patient is brought to the casualty with the history of snake and features. Guys, you have to see here the snake is this is the correct. This is a band, white band, and you have to see this is the prong of the frang marks of the snake, and this is it is going to the neurotoxic. So what happened? It is the okay. Yes. This is the case of the cobra. No, it is correct. Cobra is like this is the having the spectacles. Is it correct? White lines. The most common cause of death in the neurotoxic snakes are the respiratory paralysis. For the hemotoxic guys, it is the renal failure or bleeding. You see the diamond like. Always remember the one question is always asking from the snake bite is the always you have to clean with the water and immobilize the limb and wrap a bandage, not too tight. You have to wrap because it may have the chance of the lymphatic spread. You have to not press tightly because it will be spread to the lymphatics also. Do not do the tonic. Do not suck with the mouth. I think you may see in the movies. They are whenever there is a snake bite, like this only. You have to not do this one. Next is who is responsible for handling the investigation in the case of the custodial death. Guys, see here we have total two here. We have please remember this one. Inside the courts, guys, we have the types of courts here. See here, this is the lowest one. This is the judicial. This is the judicial magistrate. GM. This is the imprisonment power and the fine. The judicial magistrate, we have the second class, first class. Second class GM having the 1 year to give the imprisonment and the 5,000 fine, and the first class having the, which is also called a metropolitan magistrate, having the fine up to imprison 3 years you have to give, and they will give, and the fine is 50K, 10K. Okay, now. So next one is the chief JM, 7 years. Imprison power is a 7 year, and the fine is unlimited. From the chief JM onwards only, the unlimited fines are started. Next is the next one is the session judges. They are the assistant session judges. The imprison time is he will give the imprisonment for the 10 years. For the additional district and session judges, right, he can give the death sentences. So guys, for the death one, guys, one of the question, guys, they give the who can give the death sentence. Death sentence means who can give the death sentence. It will be additional death DD additional district judges and session judges. They only give the death sentence, and the fine is unlimited. And last one is the district and session judges, and the High Court and Supreme Court is most one. This is the judicial magistrate lower, highest is the Supreme Court. Next is the High Court. This is the big to low, low to high. See, judicial to session judges, they will manage by the they are appointed by the state governments, but the session to the Supreme Court they are by the central government. See here for the police inquiry, guys, there is just CRPC is 174. Overall minimum how to rank must be head constable. Okay, na? See, for any magistrate inquiry, guys, see, for the police inquiry, CR 174 CRPC, for the magistrate inquiry, have 166 CRPC. So we have for the magistrate, guys, we have the judicial magistrate and the executive. For the judicial magistrate, guys, we have in the death in the custody and the rape in the custody and the disappearance like prison death, child institution. If the child is not child institution, if the child is disappears, there is a police and there is a mental hospital cases. It all will be seen by judicial magistrate. Only the executive magistrate, they will only see the dowry death. Dowry death is by executive. Dowry death is by executive magistrate, and the exhumation means what? Exhumation. It means what? If the patient is if the death body, you have to like what you call from they already buried in the matti. Okay, na? I don't know how to say in the English. Okay, na? They say exhumation. Okay, na? They will remove the dead body from the earth. So okay. So please remember this one. And also, guys, Pbg of the patient, I think everyone knows about this one. Is going to respiratory acidosis. Please remember this one. The pH is 7.3 to 7.4 is normal, and the CO2 is 35 to 45, and has carbon dioxide. No, carbonates is the bicarbonate is the 22 to 26, and the O2 is 80 to 100. If the pH is less than 735, what is acidosis is the alkalosis. Please remember this. Please follow this one. And please remember this one also, guys. Okay, na? So are you able to get to this one? I always ask me one question, guys. Please remember this one. Last 5 questions. Traveler's diarrhea. This is travelers. Travelers. Enteroinvasive E. coli. Dysentery. he, hemolytica. It's a hemolytic uremia syndrome, and the targeting code for O157 S7. EAEC, enteroaggregative E. coli persistent diarrhea. See, guys, I have some extra miles from the microbiology. Please remember the Vibrio cultura TC-base is the media. Dirty motility, rice water stool increase the camp. Salmonella best media is the Wilson and Blair. There is a Jello, XLD, and this is a selective media. And the scar formation seen in 2 cases. It's anthrax. They will give the history of the cattle history. Scrub. They will give the history of the bite mite. Conibacteria. You have to please remember this one, guys. Please remember this one. Please remember this one, guys. Okay. Next one is the from the malaria, guys. Malaria topic. They told that total gestation diagnosed with the falciform malaria. For the falciform, guys, you have to give the Q9. For the Vivax, you have to give the chloroquine. But the Primaquine is contraindicated in pregnancy and also in the G6PD deficiency, guys. In the first trimester, you have to give this one. Second trimester, you have to give the artemisinin. Please remember this one. Plasmodium falciparum. It's a brana crescent shaped Morus dot. Plasmodium vivax. There is a dot like scuffness dot, and there is a band shape. This is the band shape. This is the Gemens dot seen in the Plasmodium malaria. In northern east part of the India, you use the artemether and the lumefantrine, and the rest of the India they will use the artesunate plus sulfadoxine erythromin. For the relapse, they will use the Primaquine. For the cerebral malaria, it is the artesunate IV. And please remember this one. For the thick, there is a blood smear thick and thin. Thick is for the parasite identification, thin for the species identification. Please remember this one. Pyogenic liver abscess, amoebic liver abscess, and hydrosis. See, pyogenic liver abscess caused by the worldwide E. coli, ACI, Klebsiella, and please remember this one. And the Histolytica america, Histolytica caused by amoebic liver abscess. You will see the Anchovy sauce pus. There is the intestinal amoebiasis. and there is a enterohepatic circulation. They will spread, and mostly they will invade is the right lobe. Investigation choice serology, metronidazole is the drug of choice. And here there is antibiotics. There is a hydroxide. There is a water lily sign by the Echinococcus granulosa, that is dog porkworm. Definitely host a dog and intermediate sheep, extended man. You have to see this one. Of significance for comparing means of two groups. Means of two groups, it is a unpaid test, guys. For the average, if you want to do the average for the before and after, if you want to check the before and after, you have to get it is a paid. Two groups is unpaid. It is three groups. It is a ANOVA. More than two groups. Non-paid, like they give the history of hypertension and diabetes. They are going comparing the two groups. It is going to the chi square. Okay, now. Chi square. Okay, na? This is chi square study. This is a component graph one by one. See, this is one by one component bar graph. Histograph, there is no gap for one histograph. And simple bar graph, there is a line. There is a gap here. This is line graph. This is called a secular trend of diseases. See, line graph. This is a forest plot. See. To know the effect of the tobacco use and birth rate of newborn, a study was designed on a delivered mothers and the history of tobacco intake or reported. The study design is. So guys, this is going to be the case control. I think everyone knows about this guy. For the rare disease, you have to do the case control and cohort study. See guys, cohort outside case control. See, cohort is the prospective further studies. Okay, now, but the case control is the retrospective. Is a retrospective study, past study. You have to go to past and you have to do the everything. But the cohort is the further you have to see. Okay, now please study the table. And guys, the last question is that difference between the Parkinson and the Alzheimer's. See, Parkinson is guys, there is a trimmers, resting asymmetry, and the pill rolling, cogwheel like rigidity, bradykinesia, shuffling gait. There is a posterior inability, there is a mass graph and the micrographia. You will see the Levy bodies and the histopathology. Drug as a levodopa plus carbidopa is the best drug of choice. For the drug-induced Parkinson syndrome, you have to use the benchexor. For the Alzheimer's, guys, it is seen in the more than 70 years, or they have dementia. They tau more. There is less tau protein. This is called a neurofibrillary triangles. There is a Hirano body, that is the actins area. The drug of choice is the Danopaja, the most common. Then Danopaja and rivastigmine, you can use the PASH like the galantamine, and the memantine is the diagnosis. They are the anti-cholinergic drugs. These are the donepezil, rivastigmine, and then memantine is the NMDA agonist. Orthopedic important topics. Please remember hip anterior and posterior dislocation, bone tumors, osteoarthritis, rheumatoid arthritis, ankylosing spondylitis, osteoporosis, rickets, scurvy, osteoporosis, osteomyelitis, fractures like Galeazzi and Monteggia fracture, Colles fracture, Narius radial and blah, blah. Please study this one, guys. Okay, na? And all the best for your Fmge examination, guys. Please study hard. I will also try to post all the topics which I didn't cover in this session, guys. I will also try to make the part 3 also if there is time for me. If I have time for me, okay, I will try to post in the Telegram also, guys. Please, guys, please master these 2 papers. You will get the 50+ MCQs from our topics which I discussed. Please, guys, you have to pass. You have to prove. You have to make your parents proud, guys. Okay, now please, all the best for your examination, guys. You will do it. Believe on your hard work, guys. Believe on your hard work. If you are doing hard work, guys, everything is going to be, you are going to success in the examination. Thank you very much, guys.